Hi, happy Monday. I'm Harlee Palmer, physician assistant here at Thrive. February is Heart Month, and certainly sitting outside in the sunshine I know is good for our overall health, but I did want to talk about APOB today. That is a blood test that you might not be getting, but you definitely want to put that on your radar in terms of assessing your risk for cardiovascular disease. Globally, we know that heart disease and stroke is the #1 killer. Women are actually 10 times more likely to die of heart disease than they are of breast cancer. And these numbers are really not getting any better. We do need cholesterol for life. It's essential to life. Our cells are made up of cholesterol, and hormones need cholesterol for production. So cholesterol in and of itself is not a bad thing. It's just that how the cholesterol is transported around our body and these little lipoproteins that they are encased in can become problematic. So cholesterol is not soluble in water. Think about pouring olive oil into water. And so it has to be chauffeured around the body to get to where it's going. And it gets encased in these lipoproteins. So LDL is low density lipoprotein, HDL is high density lipoprotein. And each of those lipoproteins is also wrapped up in a molecule called apolipoprotein. So HDL is wrapped up in apolipoprotein A, and LDL, the quote-unquote bad cholesterol, is wrapped up in something called Apolipoprotein B, or ApoB. We do know that ApoB is directly related to cardiovascular disease. And what happens is the inside of your blood vessels, the endothelial layer, that's that one cell lining of your blood vessels, has openings that allow different molecules and white blood cells and nutrients to pass through. But ApoB tends to get stuck. And so if it gets stuck, over a lifetime, many years, that can start to build up. And what that does is your body starts to want to stabilize that. It gets oxidized, and that can cause these plaques. And if the plaque is unstable, it can rupture, and that's what can cause a heart attack or a stroke. So it's really important that, one, we know what our ApoB levels are because we want them to be low because it's long-term exposure that puts you at risk for a heart attack or a stroke. And then we also want to keep our endothelial lining healthy. The ways that you do that are, one, if you smoke, you need to stop because smoking is one of the worst things that you can do for your blood vessels. You also want to make sure that you're controlling your insulin levels. So high blood sugar causes a lot of inflammation to that endothelial lining. ApoB gets in, there's a lot of inflammation, it gets stuck in there, and it just gets bigger and bigger and just causes a big glob that clogs up the artery, basically. You also want to manage your blood pressure. Having high blood pressure is another reason that your endothelial lining may get damaged, and that ApoB causes that damage on top of it. Exercise is great for the endothelial lining, so definitely want to work out, get moving, and then also just eating really good, clean, whole food diet is also really helpful for maintaining that healthy vascular system. So if ApoB is not on your radar yet, do talk to your provider about that, and also talk with them about ways that you can potentially lower that. And I hope you have a great week.